And GSI Health Coordinator is a platform. We like to refer to it as a clinical operating system, and enables a set of applications or an app marketplace. And those are the kinds of tools that all the care team is accessing through a dashboard, and you see that in the middle column. It's a web-based system, and you see the little picture of a dashboard there. Going back to the platform for a second, it's very extensible, so applications can be added slowly over time. In the Southwest Brooklyn Health Home case, it was important to get comfortable with creating care teams and assigning patients to those care teams, and having a coordinated care plan that was dynamic and available to all members of the care teams across the continuum, and focus on that first, and then begin to do things like secure messaging among the care team, reporting and things like that. And the HIE that you see represents the statewide health information network for New York, or the SHINY or BHICS that David mentioned. And BHICS and SHINY are really one of the same in New York. But essentially, we have a health information exchange under the covers that allows us to connect to BHICS very easily and very simply. So we're connected to that capability. There's lots of electronic health record systems that are connected to BHICS/SHINY. Maybe I'll just say BHICS from now on. And so all of that data comes into our platform and populates the different applications, and I'll talk more about that. And there's an ability for the clinicians to see the data that's coming from the health information exchange and decide what they want to bring in to the care coordination record, right? They don't want to clutter it with problems that don't matter to the set of macro issues for this patient that are being managed by the care team, or right, these top-line urgent components. So there's a way to do that. And so the system is really agnostic to the HIE. It can connect to any third-party HIE and fill in some gaps if that's required, which is what we're finding across the country. And so I mentioned the user interface. We refer to it as a health home dashboard. It's a set of applications. You see an iPad below. There's a lot of care managers in the field using iPads. It's not a mobile app officially, but it does work well from the browser on the iPad. It will be a mobile app soon. And then across the furthest, the right side, is the set of applications that are available to the health home. Not all of them yet, but all of those are coming. The two bottom ones, patient engagement and population manager, are coming in the first and second quarter of 2013. But I'll just say a little bit about the applications. The enrollment application